Psychopathology basically is abnormal psychology, right? Which is psychological disorders which are caused and are reflected through our behavior, psychology, their biological dysfunctions. It's important that that's not relevant to the cultural context and not accepted by the culture. It's associated with distress and impairment. It also makes the person suffer and it makes their life a little bit risky. And the suffering can be in the form of death, pain, or any form of impairment. Um, Now, usually, when you're trying to diagnose a person with a mental illness, first you'll ask them for the current symptoms, right? And those current problems you'll try and assess with the symptoms that are there for each disorder, and how much of a correlation is there, you will accordingly diagnose them, right? If the symptoms are similar to one disorder, then it's one diagnosis. If it's similar to two different disorders, then you give them comorbid diagnosis, right? So what symptoms are essentially for is to segregate between different kinds of disorders and from common distress, from common stress. Okay. Now, symptoms can have two types of onset, right? There's acute onset, which is the patient or the client will have a sudden increase of symptoms with a disorder, right? It'll be sudden and very intense. So something like getting a panic attack is an acute onset, right? Where it will happen like that and be really intense. Whereas, say, for example, schizophrenia may not be as intense or as sudden, right? It might take a little bit longer. Depression might take a little bit longer, right? Generalized anxiety disorder might take a little bit longer, and it will stay for a longer amount of time, right? So chronic onset is long drawn, it takes time, right? It builds slowly and it's not very intense, but it just stays just at that level. So it's harmful, but it's a more pervasive form of disorder, right? Now, in terms of classification system, there are different terms, right? The first is that classification itself is called as taxonomy, right? So when you're saying classification, the scientific term for classifying anything is called taxonomy. So you create a taxonomy of things. Okay. Nosology is the taxonomy used for psychological or medical phenomena. So anything that is medical or psychological illness or classification related comes under the branch of nosology. Okay. In that branch, now there are multiple types of taxonomies. Within each of those taxonomies, within that taxonomy, for say DSM taxonomy, there are nomenclatures. That is the labels attributed to different nosological labels. So mood disorder, anxiety disorder, etc. disorder, A disorder, B disorder, right? So nomenclature is the names. Nosology is the taxonomy for psychology or medical phenomena. Okay. Uh, Nomothetic strategy is the method of classifying based on identifying a disorder and its pattern. So if you find symptoms that are common between different types of mental illnesses or one particular mental illness, so you find say schizophrenia, and you find that everyone who has schizophrenia either has two of the following five, right? Delusion, hallucination, catatonia, undifferentiated kind, and something else, right? So there are five different types of symptoms they can have, and any two, if they have, then you can diagnose them with schizophrenia if the active phase has been there for more than a month, right? So these things, right? These patterns are put together, seeing doing research, right? And this is when you pattern something like this and you say that okay, these five symptoms together form schizophrenia, and anyone can have two or more of these, then you're following the nomothetic strategy of classification, right? Now there are different approaches to classification. There's a classical categorical approach which create categories that are rigid, which are unchanging, right? So these are like say medical categories usually. So for example, if somebody has um, appendix problem, right? If they have an appendix problem, the appendix starts to swell up, right? The only answer is remove it. It's a problem, right? So that's rigid. That there is no other solution. They won't give you medication and all this, right? If it's swelling up, the only solution is go to surgery, cut it out. So that's a rigid categorical approach, saying that swelling of your appendix means removal, right? Then you have the dimensional approach, which there are categories along a range of behavior, right? So it starts off small and then slowly it might get more intense and more extreme, right? So say for example, cancer, if you take, right, there is level 1, 2, 3, 4, 5, like that, right? So there are different categories, there's a range, and then there are different types and in terms of strengthening or worsening of the situation, right? The prototypical approach is where you combine the two. So you create a category, and within the category, you create a dimension, a continuum, right? So this is what mental illnesses today, according to the DSM, are categorized as, according to the prototypical approach, where you have, say, an autism spectrum disorder, right? So there's an entire spectrum, a continuum from A to B, and within that you can get different types of categories, right? So the DSM works on that pattern now. It's updated every 10 to 20 years. The current edition released in 2013. It's called the DSM-5. Before this, we were using DSM-4TR, which was using a different classification system. The ICD creates the International Classification of Diseases. So this is not restricted to just mental illnesses. It has all diseases in the world. And this is created by the World Health Organization. Under the F, the letter F, right? All mental illnesses are classified from 0 to 99. Right? 0 to 10 is this group, 10 to whatever, 19 is this group, 20 to 29 is this group, like that.